Hello, my name is Karley Oxley, and this is my informative speech for Communications O2I, a clinical nursing specialty. Ever wonder who does the job to put a person to sleep before surgery? According to a research pamphlet, in 1846, William T.G. Morton was the first to use ether during surgery. This would now allow patients to not undergo pain during surgery or any type of procedure. Catherine S. Lawrence became the first nurse anesthetist during the Civil War period 15 years later. Nurses were the first providers of anesthesia and became the full providers after World War I. I did my senior project on the career of the nurse anesthetist and had a licensed CRNA as my mentor. I received one-on-one connection with her and was able to enter the operating room and see what she does on a daily basis. In order to better understand a nurse anesthetist, it is important to explore what a nurse anesthetist does, the types of anesthesia given, and how anesthesia has broadened the medical field completely. So let's monitor what a nurse anesthetist does, stitch together the different types of anesthesia administered, and measure how anesthesia has changed the medical field. First, let's monitor what a nurse anesthetist is. What is a nurse anesthetist, you may ask? A nurse that specializes in administration of anesthesia. To become a certified registered nurse anesthetist, the first step is to obtain a bachelor's degree in science and have at least 2 years of experience in a healthcare facility. According to an online article from Minority Nurse, the prerequisites required to be accepted in an anesthesia program is a bachelor's degree in science, a license as a certified nurse, and at least 2 years in an acute care setting, such as surgical or intensive care unit. CRNAs can be employed for hospitals in labor and delivery, operating rooms, and the ER. They also can work outside of hospitals in group practices, such as for dentists or plastic surgeons. Before giving a patient anesthesia, a CRNA must encounter the patient's general health, allergic reactions, or any previous surgeries. As noted by the Institute for Career Research, to be a nurse anesthetist, relying on one's own observations and being able to take orders and correctly follow them is a must. Now that we have monitored what a nurse anesthetist is, let's stitch together the different types of anesthesia. What is anesthesia? Anesthesia is a drug administered to minimize pain and is intended to give one or more different states of being. This term comes from the Greek for loss of sensation. Anesthesia is known to relieve pain, give amnesia to knock out memory of the procedure, paralyze muscles, and reduce anxiety. There are 3 known types of anesthesia: local, general, and regional. Local anesthesia is injected directly into the surgical area. It is used on a small part of the body, such as the tooth or a small area of skin. As you can see from this image, this is the main type that is used in dentistry. The next type is regional anesthesia. This type is injected around the major nerves or spinal cord. This is used on larger portions of the body, such as a limb or lower part of the body. Peripheral nerve blocks are injected around the major nerve groups, which is in the feet, arms, and hands. This type is also known as spinal anesthesia. This is an example of a woman receiving an epidural during labor. The third type is general anesthesia. This type is given through a vein or can be inhaled with the use of a mask. Inhalation masks are used more commonly in children. This anesthesia affects both the brain and the entire body by relaxing all muscles. This type is the only one that fully sedates you. Now that we have a better understanding of what a nurse anesthetist is and the different types, let's measure how anesthesia has changed the medical field. In the past, surgery was the last option for people and numbers were low. Narcotics were used from a plant, such as marijuana, for the patient to sleep. Alcohol was the only known substance to decrease pain, but could cause patients to become ill or even die. The first anesthetic was invented in the 1800s, which was nitrous oxide. The gases have improved from the past, and the improvement of these gases enabled anesthesia to have fewer side effects. Throughout this speech, I've explored what a nurse anesthetist is, the different types of anesthesia, and how anesthesia has broadened the medical field overall. Now that I went over what a nurse anesthetist is, the types, and how anesthesia has broadened, you now have a better understanding of this profession. Now you know if you ever experience some type of surgery, how you are put into a deep sleep and who is responsible for doing so. Thank you.